Good afternoon or good morning, everyone, depending on where in the world you are. You're very welcome to today's SafeHabitus Webinar, which explores farmer health, the missing condition for farm safety. It's great to see such a strong turnout from across research, policy, advisory services and farm organisations, and of course farming communities joining us here today. As many of you will know, SafeHabitus is funded under the European Horizon program, with a very clear and ambitious mandate from the European Union. We are tasked by the European Union to not simply generate more statistics on accidents, but to enhance understanding of the root causes and consequences of occupational injuries and ill health amongst farmers and farm workers. In other words, to really look beneath the surface. And today we do this by exploring the links between the health of farm workers and farm safety outcomes. So in terms of, if you can move forward one slide, please. Some housekeeping rules for today. So before we start, the webinar is being recorded and the recording will be available on the SafeHabitus YouTube channel. Please keep your camera and microphone muted throughout, and you can submit your questions to the speakers and presenters using the Q&A function. And we strongly advise that you do submit your questions and your comments and observations, and we will pick up on these in the Q&A session later on. And you can also use the chat function to interact with each other, but also the organisers in the background, Adel, who are taking care of all the technical aspects of today's webinar. So in terms of the agenda for today, I will be handing over to my colleague, Diana Van Doorn, very shortly, who will give a brief overview on the intersection between farmer health and farm safety. We'll then hear from Erica Scott, who is based in upstate New York, who will talk about some of her research looking at who's affected by agricultural injuries. Before then turning to our colleague on the SafeHabitus project from SVLFG in Germany, Klaus Klugmann, looking at how we move from evidence to practice, so the integrated model supporting farmers and farm households within Germany. And then we'll move into a panel discussion, and the panelists will introduce themselves at that particular point in time. And then finally we'll have a Q&A session and wrap up and close. So next slide. But before we hand over to Diana for her presentation, I just wanted to mention that we have an upcoming webinar on the 18th of June, and this deals with migrant agricultural workers and ethical trade in Europe. So this is, again, thinking about the system that surrounds farmers and farm workers, and thinking about how ethical trade systems or platforms can support better working conditions for farmers and farm workers. So I would encourage you to join us on the 18th of June to hear more about that. And with that, I'm going to hand over to my colleague, Diana Van Doorn, who will briefly introduce herself.
My name is Diana Van Doorn. I am a research officer, farm safety, health and well-being at Jagersk. And I will present to you today a brief literature review, which we did on the associations between farmer health and farm safety. So if we can start the slides. Yeah, the next slide, please. So before I go into the evidence, I would like to introduce John and Frank to you, two Irish farmers, two brothers, and they work on the same family farm since they were young men, and using the same equipment, same livestock. They have roughly the same age and same farming experience. And John is healthy, sleeps well, copes with the daily pressures of farming. And Frank, on the other hand, has lately some trouble sleeping, some pain in his back, is suffering from high blood pressure. And while these brothers face the same farm safety and hazard risks on daily basis, their risk for injury is very different. And I illustrate that with my presentation today. Next slide, please. First, I go into a quick overview of the health status and safety in Irish farming. Research shows that 74% of male livestock farmers have 4 or more risk factors for heart disease. 86% are overweight or obese, which compares to roughly 68 to the national average of Irish men. More than half reports an MSD, and 37 of them experiences back pain and 25 neck and shoulder pain. And 60% of non-smoking farmers experience respiratory diseases. Many farmers also have mental health concerns or issues, and more than half experience sleep problems, stress, burnout in 1 in 4 farmers, and poor well-being. And if we're then looking at the farm safety statistics, it is the most hazardous job in Ireland. And in 2025, for example, 23 farm fatalities were recorded, which accounted for 40% of all fatalities, work-related deaths in Ireland. And the main causes are vehicles, cattle, foals, and machineries. And these numbers tend to be roughly the same every year. Next slide, please. So what are the associations between specific health conditions in farmers and farmer injury risks? And these are all international research who looked at the injury risk, and we see that clustering of risk factors, heart disease risk factors, high blood pressure, high cholesterol, and obesity, which are very common clustering when you have heart disease, is associated with 5.5 times higher risk in male farmers, and this was an American study. Obesity is associated with 3 times higher injury risk, and it also increases the risk for an recurrent injury about 5 times. Arthritis is associated with 3 times higher risk of livestock-related injury. Short sleep, 5 hours or less, is associated with 2.5 or 2.4 times higher injury risk, and short sleep is also associated with a higher risk for heart disease. Hearing loss is associated with 2 times higher injury risk. And then we're looking at the use of medication, cardiovascular medication in men over 45. Has been associated with 4.2 times higher risk of farming injury, and antidepressant medication longer than 3 months use with 1.3 times higher risk. Next slide, please. So how do these health issues affect farm safety and the risk of injury? So we identified a few pathways. And if we're looking, for example, at physical health, we see that conditions like back pain, arthritis, and obesity can lead to stiffness, reduced mobility. Heart disease can lead to fatigue, tiredness, short breathing, and these conditions can lead to slower reaction time. And you can imagine a farmer who has slower reaction time or painful knees, is stiff, cannot step back as quickly or mobilize themselves, for example, when an animal lunges. When we're going to look at cognitive, mental health, and sensory issues, we see that stress and mood disorders, medication side effects, hearing loss can reduce focus, reaction time, and awareness, and therefore, again, not adequately responding to situations that occur unexpectedly, also when protocols are followed. Financial and economic pressures can lead to farmers feeling they cannot stop working even when they feel unwell or fatigued or pressured, or they cannot hire labor, or it's also very difficult to get access to labor. And financial pressure shapes daily work intensity and decision making, and is therefore a structural pathway to farm injury. And then there's a few vulnerable groups. You can think of older farmers, children, people with ongoing health issues, which impact health behavior. If we're looking at certain young people who think that they're invincible, or older people, or masculine behaviors by thinking I'd sort it out myself first before I ask for help. And also what can impact capacity and therefore can lead to injury risk. And then there's an undercutting or underpinning factor, and that is poor sleep and fatigue. This amplifies every other risk and pathways which we just highlighted. Fatigue can affect judgment, balance, attention, and reaction time all at once. Also, troubled sleep or not enough sleep can stops the body from restoring blood pressure, restoring and recharging, and recovery from health issues or injuries. And it is very important to understand that these pathways do not act alone. They often overlap and reinforce each other and build gradually. And then SafeHabitus survey, which we done at the ploughing in Ireland, showed that farmers with work-related stress are significantly more likely to also report major impact from physical conditions. And the strongest association was seen with injuries from accidents. Next slide, please. So this is a very simple diagram for a very complex real life issue. And this is where the relationship between health, injury, and safety connect to each other. So poor health increases injury risks. We saw that, the risk for accidents, but injury also worsens health because of pain, disability, stress, and financial loss. And poor health can then make future injury more likely. And this is a constant moving cycle which can reinforce each other. It's important to understand that this cycle does not always start with poor health. It can begin with an injury, it can begin with high workload or prolonged stress or fatigue. But once you're in, it doesn't matter when you enter this cycle, at what point, but once you're in the cycle, it is very difficult to break it. The effects of this cycle go beyond the individual farmer. When a farmer is injured, family members often take on the extra work and increasing their own risk. And farms may experience reduced productivity. And Erica will talk about this more. Next slide, please. So what does an effective response to this cycle and this health and injury look like? And a good practice example is the Farmers Have Heart Cardiovascular Health Program, which was carried out in Ireland. And this program addressed the finding that Irish male farmers have 7 times higher premature mortality rate compared to salary jobs. And that were farmers in the working age from 15 to 64. Yet farmers, especially male farmers, remain hard to reach by traditional health services and with health prevention. And we have seen earlier in this presentation that a clustering of high blood pressure, high cholesterol, and obesity increases the risk for an accident 5.5 times. So this reframes cardiovascular disease as an only public health concern to also an farm safety issue and an agricultural policy concern. So what the program did was to redesign the delivery, the system to reach farmers rather than the farmers themselves. So we brought a real world year-long health program to farmer workplaces like livestock marts, and we used a farmer-centered, gender-sensitive and strength-based approach to reach them. Farmers received a baseline health check, follow-up support to make changes to their lifestyle, and a repeat health check. And the program was delivered through a multi-actor partnership, which included health organizations, education, and research, agricultural and farming organizations. 41% of the farmers participating in the program improved their cardiovascular risk profile. But farmers also reported to have more energy as a result of making healthier lifestyle changes, feeling fitter, sleep better, less stress. Some farmers lost weight and feeling more alert. And that sentence I always liked, a lot of farmers said that I feel better in myself. And these factors also all are directly linked to safe farm practices. So there we can see that health intervention and health prevention also improves farm safety behavior, or can improve farm safety risk. Next slide, please. So this is my last slide because I want to go back to Frank. As Frank's health problems build up, his farm work stayed the same. It just became harder to do it as safely. And this change is usually gradual and almost unnoticeable. Frank adapted more and pushed a little bit harder. Risk increases quietly and often long before an accident occurs. And breaking this cycle is not about telling farmers like Frank to be more careful or to cope better. It means recognizing early when health issues and work pressures begin to limit how safely the work can be done, and responding then, so on time. And this requires a system that treats farmer health as part of farm safety. Notice health strains and before injury happens, and focus on prevention. Support farming during illness and recovery as part of farm safety, and link health and safety support rather than running them separately. Thank you. That was my presentation for today.
Thanks a lot, Diana. In perfect timing, I would say. I think we can proceed with Eric, please.
Hello, everyone. Shall we move on to the next presentation?
Yes,
Indeed.
please.
Yes, please.
Perfect. Perfect. One moment as I share my screen. Excellent. Well, thank you so much for inviting me today to join everyone for the SafeHabitus webinar. I'm very pleased to be here. My name is Dr. Erica Scott. I serve as the Deputy Director for the Northeast Center for Occupational Health and Safety. We are based, as David mentioned earlier, in upstate rural New York, and we are one of 12 centers around the United States that are funded through the Centers for Disease Control and Prevention through the U.S. National Institute of Occupational Safety and Health. And we focus specifically in farmers, loggers, and commercial fishing health and safety in a very extensive way. So very pleased to follow up on Diana's wonderful presentation, because much of what she spoke of and the impact on injury does play into the presentation that I will give today. So we're really looking at who are affected by agricultural injury, and specifically not just the farmer, but the extension of that effect as well. So as she put very well previously, we don't exist in silos. I think if we look at the social ecological model, and that the individual is centered and nested within relationships in their lives, within their community, and within overall society. And we took that model and adapted it a bit to the integration of agricultural workers between their families, communities, and societies as well. And it's very, as I'm sure everyone can attest to, very integrated in this particular industry, much more so than in many other industries. So the research question that was initially asked was, how was the burden of agricultural injury described in the literature? And we really dug into this several years ago to understand beyond the simple injury statistics, as David said at the outset, scratching beneath the surface and understanding what the true impact is far beyond just the numbers. So to undertake this, we went through a literature search process, a scoping process. We had the pleasure of reviewing nearly 3,000 English language peer-reviewed articles that were published between 1980 and 2021. So this work was done a few years ago, and filtered down to those that really had a sense of burden, again, beyond just the simple numbers. So we ended up having 116 of those articles that were eligible for the full review. Of those, and again, thinking about in the English language, we had many of those from the United States, from Canada, but also many from Australia and parts of Europe and beyond. So we tried to have inclusion of varying perspectives on this work. And also it was somewhat difficult to dig into the literature to even find the mentions of this at times. And within the United States, we had broad representation across the US in terms of reporting on papers, some maybe not specifically to a particular state, but region. And in digging through those and really reviewing them, we were able to identify the major nodes. And the reason that I'm sharing this particular figure here, and it's color-coded, is not necessarily to hone in on every single label that's within there. However, if you look inside, the blue area relates to issues for the injured person in particular, many of which tie into what Diana was speaking about the medical issues, complications with health following an injury event, living and working with pain, and the impact of being away from work. The gray area talks about the employer, and often in our context, many farms are very small. There's a very vast difference across the United States in terms of farm size. And some of the work that comes out will talk about the impact of that on the business when an injury occurs. Further moving on in the yellow section, the impact to society was captured as much as we could. And quite importantly, down at the bottom was the impact on the worker's family, and particularly for those family farms. What did they then have to take on in terms of burden and impacts to their own health after an injury event? So let's hone in a little bit on the family and friends aspect, which we all know for anyone is quite important. So disability impacts on farms. These were a few anecdotes from some of the papers. So some of the work done in Ireland was looking at the impact of the household of disability on the farm business. It's no surprise that there is a major impact on the operator who may be disabled as well. However, this particular work captured the impact on the spouse of that operator. And you can see less than a third said there was little or no impact. So that means greater than 2/3 there was some or significant major impacts as well. And also significant reductions in farm family income reported, potentially not a surprise there, and impacts on the farm business as well. When you take one hardworking person out of the equation and others need to try to fill in, are the structures and supports even available to do that? And how much more burden and work is that putting on those individuals, for lack of better words, sort of left behind to pick up the pieces? So the family tolls that were described within the literature are quite far-ranging, and there was interesting dynamics even within sort of the roles that family members played and the dynamics that they related to one another within the family. So the difficulty of often the male farmer sort of relinquishing that role of being the one sort of in charge of farm operations, the idea of mentally wrestling with the idea from being the breadwinner, being the person that is responsible for bringing in the income and keeping things running, to having a disability, whether it's temporary or permanent. And then again, as we mentioned, the idea that everyone else is stretched so thin. So I pulled out a few of the quotes that were quite telling in this, and some of which I think a lot of discussion of the impact that the wives had on recovery and the process of taking on more work, not only of providing health services and care to the injured farmer, but also then going beyond and providing that extra support to keep the business operations running. So whether it was milking, just taking care of everything on the farm. And, you know, some folks were saying, you know, they're not used to just laying in bed being not able to contribute, and, you know, struggling with that as well, and knowing that their children have stepped in. Maybe the children have not complained, but realizing that it's putting a great stress on them. So, and there was also quite notable effects, especially for children, in terms of missing school days, or having other impacts that they weren't able to focus just on those aspects of being young and being able to attend to their learning. Emotional burden is a huge one that we really try to dig into, and I'll speak a little bit later about doing that through some interviews. But there was a lot of trauma and anxiety expressed about reliving the injury, often from the perspective of the family members. There are certainly reports for the farmer themselves that was injured about the difficulty of moving past that and reliving that, but particularly for the worry on the family member's part about, number one, the injury happening in the first place, and then worrying again about repeat potential injury, or potentially the farmer in their recovery not getting re-injured again. And we did see reports of re-injury, trying to push through or ignoring doctor's orders because there was no other option, and sort of setting back their recovery even further. So, discussion, as said earlier, about the mental and emotional impacts, and even so far as noting that counseling was sometimes required. Potentially that would have been very needed in certain areas, but is that always available in every rural locale, etc.? So the loss of social connections as well was mentioned quite frequently. The loss of friends, whether it was because the injured farmer themselves weren't able to go out and participate in the world in the same way they could before, or that there was a self-isolation. So if you're no longer able to participate in the same way or relate to people in the same way as you were pre-injury, there was mention about that self-isolation out of embarrassment and really trying to shut out the rest of the world, which has significant mental health impacts. And that really wasn't covered. It was covered in some of these peer-reviewed manuscripts, but that often wasn't discussed in other media coverage, or sort of thinking about the context of what burden means, not only for the individual farmer, but for the overall landscape, as again, we exist in this social ecological model. So thinking about sort of community society level, we did capture information on financial impacts, which were significant. And again, these vary across the board, of course, depending on the region, country, locale, and as you can imagine, are underpinned by many of the regional and specific either regulations or supports that are in place in a particular area. So how much fatality costs were, who is paying for some of this, we really dug much more deeply into those factors. One of those in particular was about health insurance and insurance in general. And some of the coverage here that I've pulled out is more specific to a United States context, but that having no health insurance was quite common among farmers. We know that this is a case from other research that we have done at our center and from our colleagues around the US, and recognize that that may differ in terms of context for some of the European Union countries and other places around the world. So there was a huge significant burden of paying for medical bills for farmers across the board. In particular, when we look at for migrant farm workers, that is a whole nother layer of complexity in our system. So there was quite a significant there. And in addition, older research that was part of this, that published in 2000, actually showed racial disparities in coverage too, in terms of Caucasian farm owners being more likely to be covered by private insurance versus African-American farm owners. So it's all tangled up in quite a complex web here. There was discussion in many of these papers about governmental supports and the idea that there was a desire for more support to help disabled farmers get back to work, which would be ideal. There was some noting of government support for some equipment needs in order to facilitate that, but then at the converse of that, there was noted often why there wasn't enough support to kind of help someone get back up into a working capacity. noted that, policies like the Americans with Disabilities Act, the ADA, as we call it here, had very little impact on farm operations, and that regulations themselves sometimes inhibited the ability for injured workers or disabled workers to continue working, as noted in the bottom quote there, that someone's working successfully actually after their injury, but then faced issues with actually maintaining their commercial driver's license to keep doing that work at some point. So just to wrap up here, from some of the themes that we identified in that scoping review, we set out to do key informed interviews across the Northeastern United States. And we were looking at not only speaking with farmers, but these other folks affected. So family members, agribusiness, looking at the emergency services perspectives in healthcare beyond. So we conducted those interviews across the board, and really the role of familial support post-injury came up over and over again. And that came up in two ways. So either the families really stepped in a way that they could, or we're seeing more and more with the changing demographics of rural America, and perhaps someone doesn't have a family close by or is not married. For those sort of bachelor farmers that experienced the interview, there was an incredible difficulty managing post-interview. And often there was a sort of a transitioning of that support to maybe a case manager or someone in a professional role, almost taking on some of the role that a family member often would. Certainly, the trouble with that is there's typically not enough people to go around to be truly supportive. And then over and over again came up the complexity of dealing with the administrative system when trying to seek assistance post-injury to get back to work, and how complex that was. So to conclude, as I mentioned, the lacking familial support makes it very difficult. And there's that frustration in the administrative piece of it. So looking at how ways that can be streamlined or support can be provided, given the current context of how farm families operate or how farmers alone operate, is quite important. So to end, I just want to acknowledge everyone as part of this team and part of this research on the screen. You certainly can get information about the additional papers we have, and just acknowledge that this was funded by CDC NIOSH. And then lastly, I'm just very pleased to say that some of this work is continuing on in the Irish context by Sharon, who is a Teagasc Walsh scholar. So very pleased to see that going forward. Thank you.
Thanks a lot, Erica. Amazing speakers today, staying perfectly on time. Now the pressure is all on you, Klaus, to do the same. And please go ahead. The floor is yours. Thanks.
Yes. Okay. Hello, everyone. Maybe there will be a changed slide, would be very worthwhile. And yeah, hello, everyone. I would like to thank you for this opportunity to discuss the important issue of health in the agricultural sector and the social security in agriculture, and to share with you some insights into the situation here in Germany. My name is Klaus Klugmann. I have a degree in forestry engineering, and I have been working in agricultural social prevention since 2008. I work as an expert advisor for forestry and hunting at the Social Insurance for Agriculture, Forestry and Horticulture, the SVLFG, in Germany. Through my training as a safety engineer for the Technical Inspection Service, I have gained deep insight into occupational safety health conditions in the green sector. And and together with the prevention management team, I work on current challenges to improve working conditions in agriculture and forestry. And I also serve as the CUP administrator for the SVLG within the SafeHabitus framework. So far, so good. But being healthy does not simply mean being free from illness. Feeling good and being in a state of mental balance from the basis of health in the true sense of the word. That is our role and mission, and as a unique social security system for the green sector, Our motto sums it up quite well: safety and health from one source. A social insurance scheme that aims to reconcile work, health, and old age. Please, next slide. And at the very first, the statutory accident insurance in Germany is to mention the SAI was introduced 150 years ago and has worked well so far. It helps to keep social peace in companies when occupational accident happen. A key point is that the employer's liability is transferred to the statutory accident insurance institution. However, if an employer acts with gross negligence, the insurance institution can claim the cost back. In the end, it is a compulsory insurance system. Insured farms, companies cannot choose to leave it. It's a must, yes. And the SAI is the oldest and arguably most important part of the SVLFG, not least because of its scope of cover. That's very important because which extends to all family members working on the farms, as well as its statutory duty. It's very important statutory duty to ensure prevention through monitoring and advisory. In this context, it is also important to highlight the statutory duty of prevention to prevent accidents at work, occupational diseases, and work-related health risk by all appropriate means, whatever that means, all appropriate means. Please, next slide. And next slide, please. Yes, thank you. And in this context, it's very important, occupational disease represent another significant component of the SAI's benefit and costs. It's occupational disease. The aim is to maintain good health and preserve the ability to work for as long as possible. Previously, the law meant that people had to give up the work that was causing their illness in order to receive financial compensation. This was not a good solution, but this has changed in recent years. How fortunate, it's a fortune, how fortunate that we no longer have to tell farmer, for instance, you won't get your pension until you've stopped working in the barn yourself. Since 2021, it's not longer necessary to give up the work causing the illness in order for an occupational disease to be recognized. The previous requirement to cease work has been abolished. That's very good. And instead, greater emphasis is placed on prevention, counseling, and involvement of the insured person in order to prevent the condition from worsening or recurring. We work on farms across Germany on that issue. For example, we provide technical support for powered respiratory protection. This is important for obstructive airways disease, for example, diseases caused by dust during barn work. Recently, Parkinson's disease caused by plant protection products was officially recognized as an occupational disease. This creates a major challenge at the moment, currently for the SVLFG, both in terms of staff and costs. For the SVLFG, the recognition of Parkinson's disease means more cases, more benefits, higher costs, and much stronger pressure to improve prevention and prevention work on the farms. Next slide, please. And for this, we are, yes, this is the right one, sorry. And for this, we are on site at the farms. We inspect and advise the farms based on accident and work-related diseases. We also inform them about our current services, for example, health services such as mental health support, farm succession, very, very important issue, and other topics. Here are a few examples of the service and benefits. There are others, of course, too. The THD, so the safety engineering service, the TAD is the centerpiece. We head out to the farms according to the inspection schedule or on request and on the unfortunate occasion of an accident. The farm and household assistance or household help, the BHH, is essential to ensure that the family-run farms, in particular, can continue to operate in an emergency. Mediation and counseling for social and economic issue. Another service is a new service through which we aim to help our farms to find solution by providing independent expert advice. In addition, there is a special safety engineering service, the STD. Our STD is specifically designed for employers to promote and further develop health and safety in the workplace. Next slide, please. And okay, that's a little bit working up. The next one, please. Yes, that's the right one. To understand why the SWLFG is unique, you need to understand the social insurance or the social security system in our country. The social insurance system in Germany consists of 5 pillars. These pillars, including statutory health, accident care, pension, and unemployment insurance, are independently of one another and act as legal entities in the form of public law organizations. And separate insurance providers with each pillar operating independently and a large number of providers within each pillar. As in the case with health insurance, there are currently 93 health insurance providers covering around 90% of the population, many interfaces with the other pillars, and a lot of friction. Next slide, please. And that's the unique thing of the SWLFG, a one-stop shop for social insurance. That is precisely what makes the SWLFG so special in Germany, and there is no one other like it. Yes, I'm serious. And it combines all social insurance areas relevant to the green sector in one organization. It is self-administered, focused on the specific needs of the sector, and strongly oriented toward prevention. This is main advantage over other social insurance institutions, which are often more separated and less closely connected. And lest anyone get the wrong impression from the praise of the SWLFG, bear in mind that there were a slide, there's of course also shadow. And the SWLFG is constantly adapting with the aim of improvement and optimization, in brackets, as far that the constraints of the legislation and finances, etc. allows. And we have a number of challenges to overcome. And of course, there are areas where things could run more smoothly, of course. Advantages of the system, the one-stop system, fewer interfaces between different institutions, close to the sector, solutions fit agriculture, forestry, and horticulture better, prevention on-site, advice is given directly on farms, in businesses, cross-insurance view, health, occupational safety, rehabilitation, and social protection can be considered together. Self-governance, very important. The sector itself is involved in decision-making. And of course, the disadvantages and challenges, complexity, combining several insurance branches make the organization demanding, financial pressure, structural change, fewer farms, and demographic change put pressure on the system. Special status needs explanation. Compared with other social insurance institutions, the model is not always easy to understand, since the specific social needs of this sector are largely unknown. Question about it crop up time and again, and over time it becomes tiresome to constantly have to explain oneself and justify one's right to exist. But by working together with the profession of the green sector and the political network, we can ensure that we continue to exist as a social security scheme as we have done up now. Yeah, please, next slide. And now on the topic of health. Yeah, the agricultural health insurance, the AKK, in Germany, health insurance is compulsory for everyone. Anyone residing in Germany must have health insurance. And in that case, that is quite socialistic, I think, about it. So stop thinking it's not socialistic, it's a good solution. And the farmer, as an entrepreneur, we call it them that, even though they are often referred to as private farmers. And yeah, the entrepreneur and his family are insured within the ALKK. And in addition to entrepreneurial status, the size of the agriculture business also plays a decisive role in determining whether insurance is compulsory or not. The farm must reach a certain minimum size. This is determined by the SVLFG governing bodies and is, for example, 8 hectare for farm plowland or pasture grassland. However, health insurance is ultimately just one of the pillars. Cross-pillar prevention within the social security system is required. Yes, it's true. It's required under German social security law. The aim is to avoid isolated measures and to coordinate health promotion through a joint national prevention strategy involving health, pension, accident, long-term care, and insurance fund. Cross-insurance prevention is the legally mandate guiding principle for us. Please, next slide.
2 minutes left, Klaus, please.
Yes. And so we provide information and encourage engagement within topics and service specifically tailored to the agricultural sector within the framework of statutory health insurance. The SVLFC strive to implement the cross-insurer prevention measures required by law in an ideal manner. So there's still more to be achieved when all providers work together with the aim of providing needs and base and healthcare in the areas of prevention and rehabilitation between the ALKK and the old age insurance, in farm and household help between the ALKK and the accident insurance, or even through joint campaigns, which after a while are merely a name and have become a tailor-made facility for health and everyday agricultural life. Next slide, please. For this, the SVLFG has therefore set up a dedicated unit called Mit uns im Gleichgewicht, with us in balance. This unit develops specialized health service and bring them to farms. Topic range care leave and farm succession to crisis intervention and mental health programs. To this end, the SVLFG often connects partners, very important, to arrange services. Next slide, please. And all in all, we can combine the legal requirements from the various areas of insurance and adapt them to the green sector, so that under the given circumstances, insured persons receive the best possible services. Budgetary constraints and legislative changes are the limiting factors. Need remains high. Very thank you for listening.
Thanks a lot, Klaus, and we thank a lot the three speakers that opened the webinar. I will now leave the floor to David Meredith, so he can lead the panel discussion and then the audience Q&A session. Thanks a lot.
Okay, thank you very much for that, Gianluca. If the panelists could all turn on their cameras and their microphones, everyone will be able to see us simultaneously. Okay, so we've already heard from Klaus, Diana, and Erica, but what I would like to do here, yes, is bring in Francis and Agnes. So Agnes, if you're there. Zoom Agnes is still with us. Okay, well, whilst we're waiting for Agnes to connect, there we go. Francis, if you would like to briefly introduce yourself.
Good afternoon, everyone. Yes, My name is Francis Bly, and I work as a health and safety specialist advisor with Teagasc. So my role is to work with closely with our farm advisors to help farmers, farm organisations, and industry people that are working with farmers to promote health and safety, and to encourage, I suppose, farmers to manage their safety and manage their farm practice in a safe way.
Okay, thank you for that. And Agnes, a brief introduction.
Hi, I'm Agnes. I'm a French organic farmer, and I work as part of a peer-to-peer project as well as on the farmer substitution organization.
Thank you very much, Agnes. So just for everyone who's present to note that it was through these webinars that Agnes contacted me and this developed into a conversation, and she's here joining us today. So thank you very much for that. It's also the danger of maybe contacting me that I will drag you into this world, but I'm more than happy. Okay, so let's start our discussion. And in terms of maybe starting with you, Diana, in your presentation, you outlined an outreach model that achieved 86% participation with farmers who might be considered to be hard to reach. So what do you think were the important design decisions that made that possible?
Yes, I think we talk about farmers are hard to reach quite often, like farmers are perceived to hard to reach. I think it is maybe not as much as how, that they're hard to reach. You just need to go and meet them where they are. So a very important design decision in the program was that we went to their workplace and made participating in health prevention therefore very easy. We went to spaces where they had to be anyway. We went to spaces where they felt safe and comfortable and which could break the ice, because not everyone, especially in very rural areas, was comfortable with doing health prevention. So it was this support system in their locality, speaking their language, having a farmer-centered and strength-based approach, which was most important to get this participation rate, and thereby as well the multi-actor approach which we adopted, which included Teagasc, it included academic institutions, but it also included the health service, the Irish Heart Foundation, Tierlan, an industry partner. And that increased as well the trust in the program and the acceptability of the program. But because we had these organizations in there, it also increased our reach. So we could reach different subpopulations of farmers. We found, for example, in the program that farmers who were recruited at March were at higher risk based due to a very different demographic profile. So they need, and this is a very important learning, because they need a different response in reaching them, but also in decreasing their risk factors than the farmers we, for example, recruited at agri branches. So you asked for a single design.
Yep, no, I do want to bring in other people here. So thank you. That was a very comprehensive answer. But I think, the key things that I took away from that were very much the going to where farmers were and speaking their language, and trying to reduce the barriers that might prevent a farmer from engaging with health professionals to begin with, but particularly health prevention initiatives. So they were the key things that I took from there. So Erica, turning to you, maybe looking at this from the point of view of the US, where does the US evidence challenge or contradict what we've heard from Ireland or Germany so far today?
Yeah, that's a great question. I appreciate that, David. I think the thing that strikes me most most evident based on Klaus's presentation, on some of Diana's work, is the differences in the support landscape. And what I mean by that is sort of what social supports or social security is available across the board to assist this industry in particular. So it's not to say that that doesn't exist at all in the United States, but it is much more of a patchwork in our understanding. And it's not compulsory necessarily as it is in some other places. And without that, as noted with many farmers, say after an injury, not even having health insurance at all, and understanding the immense cost of the injury care and the recovery care, it is why many people experience medical bankruptcies in the United States and also experience loss of their agricultural business and their farm entirely. And other research has borne that out, that after a farm fatality, there's a certain number of farms that can no longer be sustained. And I would say that, anecdotally, that is also the case for serious injury. So that really does strike me as one of the biggest challenges. And how do we adapt programming from other places to a context that might be quite different here? And what pieces can we take that might be successful, and how can we make change?
It's an interesting reflection, and just to abuse my position for a moment, unfortunately, not everywhere in Europe is like Germany. We don't all have SVLFG. I mean, there are good examples in other countries as well of integrated systems, which are very positive, but then there are plenty of member states where the systems are weak or very disconnected.
Mm-hmm.
So we've all got something to learn here. So thank you very much for that. Klaus, well, I suppose I'll give you a chance to come back in on this, but my primary question here for you is really, how does the German model or the SVLFG model address the structural barriers? So these are issues around time pressure or labor shortages or economic stress. Or are you primarily focused on working with the individual? Microphone, Klaus.
First of all, I want to underline that's what Diana said. Our TAD, our advisory service, they are real farmers. Mm-hmm. They are on the same level as the farmers where they go to, and it's very, very important. And your question, back to your question, David, it's a wide area of answer given. So I would answer like that our model is flexible and can adapt within the given framework. The framework decides, and we cannot influence major developments, but we may be able to mitigate, channel them to some extent. Of course, we support farmers directly through advice, inspection, training, and health service. However, the strength of the SVLFG lies in the fact that we combine accident insurance, all these pillars, branches together, and thinking them together. This enables us to tackle structural obstacles such as time pressure, labor shortage, economic pressure, more, I would say, comprehensively. For example, farm and household or household assistance, farm assistance can provide support when illness or accident threaten the survival of the family farm, whilst socio-economic advice and mediation support farms under economic or personal pressure, of course. But they have to go to us. They have to ask for. We cannot strengthen them to do so. And our system of sexual self-governance is not only tasked with working with us to develop new solutions and measures. It's more important, rather, the representatives of the self-governing bodies must use their network to ensure that this information reaches the farms, so that the farms are aware that specific measures even exist. Yeah, and as I said, the main structural obstacles cannot be overcome by the SVLFG alone. They are closely linked to structural and climatic change in agriculture, demographic change, and financial constraints. That is why we need partners. We need partners, of course, with whom we can develop effective solutions and measures, and also improve access to support through practical sector-specific assistance and prevention. Yet, long-term, for instance, yet long-term solutions also required cooperative with political decision makers, the profession, and other stakeholders in the agriculture sector. And last words, how, for example, do we reach a farmer who lives alone on his farm with his father, who needs care and is struggling to cope with day-to-day challenges? So how can we identify such situations more effectively and quickly in order to set processes in motion? To this end, we are currently, and that's important, I think, we are currently launching a pilot project in collaboration with partner organization to improve our ability to identify people in need, similar as the Sentinel network run by the MSA in France. Ultimately, it takes committed people and a resource to pay them, then anything is truly possible.
Well, thank you for that, Klaus. And I think a couple of points that I would take from that, but particularly the last one, that question about caring for other members of the family, and the fact that, I mean, particularly family farm businesses, the distinction between the farm work and the family is very, very tight. And so it's very hard to say, oh, someone else should take care of that issue. But the other point that you made at the very beginning was the advisor being on the same level as the farmer, and that being particularly important. And this is where I want to bring in Agnes. So your model, well, I'm saying your model, but the MSA model in your area that you're particularly interested in developing is built on farmers learning from other farmers. So through farm visits or video calls or demonstrations. And my question is, why do you think peer-to-peer learning works where advisor-led approaches might not? And what does that tell us about how we should design support for farmers carrying health or safety risks?
Well, let me first start with the sort of caveat emptor, or just to say we can't generalize from what we do in our particular area to everywhere else, because our MSA project has been quite unique and completely pioneering. And the idea of the model is to do peer-to-peer mentoring and going into farms where we've identified through the Sentinel network that Klaus referred to, where we've trained people in identifying mental health in particular or distress situations, and going to respond to people's needs from a farmer to a farmer. Unlike what Klaus was saying, we don't have advisors, at least that I know of, in France that are actual farmers. Our advisors are professional advisors, and many of them have never farmed. And so they don't understand at all what, at least in my sphere of where I sit, the advisors we have cycle through very, very quickly. There's a huge turnover, and we don't have people who really understand the constraints of farming. So the model we've done is we have farm visits. We go on farm walks with people. We go on demonstrations. We have video calls. The idea is when someone is in a difficult situation, to match them with a mentor who is paid, whose time is not paid immensely, but their time is recognized through a sort of stipend or some refunding system, that allows the farmer to be solicited without the person who's asking for the mentee necessarily feeling like they're sort of encumbering the time, which every farmer is so, very scarce. So the idea is what a farmer who's experienced the difficulties can bring to someone who is going through them, having, let's say, quote unquote, survived them or having overcome them, is a very valuable reference. And it's much more valuable than someone who's perceived as a paper pushing desk job person, whether that perception is accurate or not. But the farmer who's done all of this is much more credible and usually much more relevant. So that's in a nutshell.
Okay, thank you for that. And this is now where I want to bring maybe Francis in, because maybe the Irish context is slightly different in terms of a lot of our advisors would be very close to farmers and farm households, and many of them would be farmers themselves, or at least come from farm households. But rather than ask you a nice easy question, I'm going to present you with a scenario, and I'm wondering how you would deal with this. So let's imagine that you're on a farm visit and the farmer in front of you is maybe a bit older, so, maybe 68, but visibly tired or exhausted. And you're there to talk about something like slurry management or biodiversity or water quality. How would you bring up health? Is there a natural moment in a farm visit where a health conversation can happen, or does it always feel like an intrusion?
So like the big, I suppose, advantage of the advisor and working with a farmer over a period of time is, I suppose, the relationship that's built between the advisor and the farmer. And when a farmer would say asks an advisor to come on the farm, there's usually a need. And we'll say, if we take the example of slurry management and the locations where maybe slurry needs to be placed and why it needs to be put there would be the reason. But the observation, I suppose, capacity of the advisor when they come on the farm, that their eyes are open, their ears are open, they're looking for signs, I suppose, of from the farmer, but also from the farm, of how things have gone over the last number of days, number of weeks, number of months, to cue conversation. So obviously the conversation is going to start with what they're there to do, but it might lead back to, well, when did you put in the cattle? How long are they in? How did they perform during the year? Was there any health issues? If they were having calves, how did that go for them? Was it a short period? And then you're kind of leading towards, well, that calving period, was that hard? Did you have many difficult calvings? Were you up late at night? Did you have much help? How did your wife or your partner feel about that? You might notice that maybe there's a little bit of a limp or something like that. Did anything happen? Did everything go well? And to lead them towards giving you information, to encourage them to talk. And look, we were very lucky, I suppose, in Ireland. We have the Department of Agriculture supporting a program called On Firm Ground, which is a training course for advisors, which helps them, I suppose, identify farmers that have health and mental health challenges. And the course also helps them to identify supports and signposts and areas. Advisors in Teagasc do not provide, we'll say, health-related advice, but we have a wide suite of places we can support. We're not lucky like Klaus to have it all in-house. We have a lot of information from partner organizations that are available to help. And that's where we see, I suppose, our ability is to identify that farmer, to help them have that conversation, try and encourage them to tell us what has happened and how they're feeling and how things have gone for them, and then trying to encourage them and then to follow up. Like, they may not do anything that day. There might be a reason to come back with a nutrient management plan to them in the following week. Ask them again, how have things gone? Have you gone to the doctor about that knee? Have you made a phone call about it? Really encourage you to try and do something about it, because you need to be top shape now for silage season, or, kind of make it positive. That's kind of the approach that we would try to take. And that's the approach when we're having in-service training with our advisors. We try to develop these scenarios, try to encourage them to think about how they can support farmers and how they can get them to talk.
Well, Francis, you're free to take the scenario I just presented you with and use it in service training.
Thanks, David.
No problem. Thank you for that. I'm going to turn to two questions that we have now. And I'm going to first, Maida, who's a colleague on the SafeHabitus project. She has a question for Klaus, and it's really a few questions here, but it relates back to where did the system that Germany has today come from? And I know we're about to get into Bismarck in terms of going back to that point in Germany's history. But you can briefly cover that. But I think the key question really is what ensures the sustainability of this system today? Because right across Europe, we see the numbers of farmers is in decline. And that obviously means, well, I'm assuming it means that there are fewer farmers paying into, we'll say in this instance, the social security system in Germany. And that ultimately raises questions about the sustainability of the service in the longer term. So, Klaus.
Yeah, first of all, the system comes from the Industrial Revolution, of course, where there are not only revolution for the new technology, also revolution in a very new and very inhuman quality of work, and that was a big social tension, and the German state want to get the workers more close to the state, so they offer the statutory accident insurance, and that they not go to the, in that time, socialist party and stuff like that. It's very brief and yeah, and so short. And yeah, it's sustainability, financial sustainability. And I think if we talking about sustainability, we have to make clear at the beginning what kind of sustainability we talking to, the economic or the environmental or the social sustainability.
Well, in this case, Klaus, I think the sustainability of the service that
yeah,
farmers
and yes,
are
the
currently
service
providing.
and the service, and that's a big problem. We are big funded by the state, of course, because we have to face and the demographic and less farms and everything like that. So we are supported by the state, and it's an everyday advantage to get these money from the state, of course. But what kind of solution is alternatively obvious? No one. We have to need the money to keep the system running, and yeah, because yeah.
Okay.
Dot.
Okay. That's a good answer, and people can fill in the blank after the dot. Erica, I want to come to you, and this is a question that Agnes posed, and it was the focus on children under 19 years of age, and it's the fact that in the US there are many children who are legally working on farms. Now we have something it's slightly different in Europe, and I think there's been an interesting conversation going on in the chat around children on farms in Europe, but it's, I think, a different issue. So can you just explain the context in terms of why do we see children working on farms in the US?
Yeah, absolutely. So we do see children working on farms. However, I would say the children that are included in the injury statistics are a combination of both some that are performing farm work tasks, as well as children that are bystanders on the farm that are likely family members or visiting that are injured in a farm event, but that were not actively working. So for the children that are not actively working, but on the farm, again, often family members, there's quite an emphasis on keeping children out of the more dangerous areas of farms, efforts like safe play areas. Some of the most common things that we see, and part of our work here is also tracking those injuries and fatalities. We often see, sadly, tractor runovers, someone backing up and not realizing there's a child behind. We've seen drownings in water troughs, in barns, out in the fields, a variety of things. Those are just a few examples. But David, you did mention that the regulatory landscape in the United States, in terms of the ability of youth workers. I think for many, it's common outside of the agricultural industry to be able to apply for a work permit at the age of 14 to do certain limited tasks. Say you could bag groceries at a grocery store, at the supermarket, you know, just as an example. However, there are exemptions in agriculture, particularly when it's a family-run operation, where work tasks often can start earlier. Some of our colleagues in the US have looked at appropriate work tasks based on developmental and sort of psychological development of children and what they could be helping with and what's more safe. And as they age, how can they process that? And then there's the fact of, you know, I'm speaking much of family farms. There also is the idea that many farm workers, migrant farm workers, have children that are often working in the fields. There are regulations around ages in terms of ability to do that, but we see often younger workers that necessarily shouldn't be there. So
yeah. Thank you for that. I mean, it's what you described is, you know, quite a distressing context in terms of children who are being seriously injured or killed on farms, and the population you highlighted initially in terms of children from farm households or visitors. We would see much of a similar pattern across Ireland and Europe in general. But the context around particularly migrant workers and, you know, the economic challenges those parents face and the decisions that they then take in terms of removing their children from school to work on farms is something that is probably unusual within in a European context. So I'm conscious of the time here. But we've dealt with most of the questions that were put into the chat. So I'm just wondering, like, amongst the panelists, I mean, you've been listening to each other speak. I mean, is there anything that you would, anything additional that you would like to add based on, you know, how you've been inspired by other speakers, or final comments that you would like to make? Okay, well then, what I'll do is I'll come back to Agnes, because you've built a funding scheme to travel, to cover travel and time. So recognizing that engagement isn't just about willingness. It isn't about saying, "Oh, we have an event on, you should come," but you're actually overcoming some of the structural difficulties for people to attend. And that means making it affordable for farmers to take part. So in your view, how important is that financial dimension, and what would be lost if the program relied on goodwill alone?
Well, we have a natural experiment because sometimes in the past times the funding has lapsed. So we see that it carries on sort of at a lower, I would say a lower clip. What makes a difference is when you have the funding, you can afford coordination, you can afford people who do the matchmaking between the mentor and the mentee. Farmers don't have a lot of spare time on their hands, so it's very hard for them to make those sorts of funding requests or look for grants, etc. So you really need a kind of a person who lubricates the whole process. The other component I think that's very important, in France we have a substitute farmer service, and so people who do mentoring, they can actually get, if they're going to be absent from their farm and their farm operation requires constant presence, they can get a substitute farmer or agent. It doesn't have to be a farmer, someone who can come and fulfill their tasks and responsibilities. So that is funded through the same scheme. Otherwise, you would find that people wouldn't be able to participate because they would be doing it to the detriment of their own, their own operations. So it's a whole tiered kind of approach of being able to liberate people to mentor and enable people to ask for help. So the funding, I think, is absolutely indispensable. We've seen it go on because of goodwill, but I don't think it carries the same impact without funding.
Okay, thank you for that. And just a brief response from me. I think the fact that there is a limited amount of funding, maybe, but it places a value on the service. It places a value on the farmer's time, and that's a really important signal. So it isn't an expectation that farmers should do this because they should do it. So yeah, it places a value on their knowledge and their experience, and that's always really important. So I want to bring things to a close, and I can see that there's been a bit more discussion there between Klaus and Maida, and Klaus is going to follow up, so thank you for that. But in terms of beginning to bring things to a close, to all speakers, one sentence only, or maybe two if you have to. But what is the one thing that you think has to change for farmer health to be treated as a core farm safety issue? So I'm going to start with, say, Francis.
Two lines is very difficult, David. So a core, like, if we can get that information that Diana presented and Erica presented for farmers to really understand the impact. And I know farmers listening to, and I know Agnes said it, you know, the peer-to-peer, farmers talking to farmers about the issues they have and the challenges they have, and this high risk of accidents associated with injuries and ill health. It's really a communication piece. It's really an education piece. And I know I've said more than two lines, but it's not simple. And it's as my previous manager used to say, there's no magic. It's just constant and needs to be continually done.
And thank you very much for that. And I think it's a very good insight. And I do recognize that one sentence is impossible. As Oscar Wilde once said, if I had time, I would have written a shorter letter. So with that in mind, Erica, in a few sentences.
A few sentences. Well, you know, I think we're increasingly looking at more upstream effects. So, you know, we can't impose so much pressure and change on an individual farmer, individual farm, because of all of the pressures they're already experiencing. And often they may know what should be done, but there are other things that come higher in the priority list. So I would say that simply there has to be policy change at many levels, whether it's health policy, etc. At a larger, whether it's a state level, in some cases, federal level potentially. But that combined with the tailored approaches that Diana spoke about, and we practice that here as well. So recognizing the context of farming is different than some other occupations and other lifestyles. But really, we have some bigger fixes to make.
Okay, thank you for that. So now, Agnes, if you want to take your brief moment to fix all problems.
Oh, we can fix them all. I think there's two or three things that really stand out to me. That one is farm income. You know, that we have a population, at least I know in France, 42% of farmers don't make the equivalent of the minimum wage. I think farmer mental health, and I think really training everyone in the space on first aid for mental health. We have a very high rate of farm suicide. I know the same is true in the US. So there are really, really good places to intervene and make a big difference that could really change sort of the attractivity of the profession, change generational renewal. Lots of things could be the levers. We know what they are. We need to be able to get them to start working.
Okay, thank you for that. And it's interesting just to pick up on that point around the training of everyone around this mental health. Within the current proposal for the new Common Agricultural Policy, there is a opportunity for member states to do exactly that. So in Article 23A, it specifically suggests that member states train farm advisors and others to support farmer mental health. So Klaus, give me your silver bullets.
I want to connect to Agnes. Yes, all this, and therefore we need a kind of a reframing to get human in the center of all perspective. That's the point, and also that the farmers know that there is help out there. that there is relief out there, that are a lot of farmers who have the same problems, and that it's a possible way to connect each other, yeah, to get what is really important. And of course, all over, it is a fair income. If you have problem with money and you don't know to pay your bills, you have no view to yourself, and that's it's a really big issue.
Okay.
Reframe farm business. You are the center of all. That.
Okay. Well, I think that's a really human way of thinking about this, and this is the way certainly I think is a very good way of thinking about the issues that we see. But it links really nicely finally to Diana, because when Diana was doing her PhD, I remember she talked to a farmer after she had run all the health checks, and that farmer made a comment along the lines that he began to care about himself when he saw other people cared about him. And it was a very impactful comment to make. So Diana, I want to finish with you in terms of thinking about what are some of the things that we could do in this space to help farmers.
Yes, it's really hard to follow up. When I was thinking about this, when you brought the center up, I was like, we need to start at the beginning and accept that health is a determinant of farm safety. So therefore, you cannot start thinking of solutions separate. And we're talking about mental health and health are also interlinked. So by bringing everything together, I feel all actions taken need to start with these components together, and that means working with actors like who are in these spaces and who need to be brought together to start reaching farmers, and also the targeted approach that the vulnerable farmer Klaus was talking about. How can we find them? So for me, it's very much as in going back to the start, as in, okay, we have farm safety, and what makes farm safety, and that is including health, mental health, well-being, and who do we need then to start reaching the farmers most in need for support.
Okay, thank you for that. I'm very conscious of the time. We've got 2 minutes to go. So I'm just going to take a minute to thank everyone for attending today. We have a lot of people who have joined us online, and I really want to thank you for your interest in this seminar and your interest in the SafeHabitus project. We encourage you to keep in touch with us so you can find out information about what we're doing next through our website. And we do have the next webinar is coming up on the 18th of June, so we hope to see you there. I want to thank my colleagues at ATL for handling all of the technical aspects of today's webinar, and also for promoting it and sharing information online around it. And we will have a recording from today online very shortly. So if you want, you can share it with your networks or listen back to particular presentations that you're interested in. And finally, I really want to thank all of our speakers. I want to thank Agnes for making contact with me in the first place to share her knowledge and experience in this space. It's brilliant to make those connections and broaden the network across Europe, because I think this is really important that we learn from each other and we have those experiences. So thanks for that. And to Erica for getting up early and sharing experience from the US, and also for supporting the translation of the research that has been done in the US into the European context. So huge thank you to you. And then to my colleagues on the SafeHabitus project, to Klaus, to Francis, and to Diana, thanks very much for your work today. And a particular thanks to Diana, who put together the program for today and did a huge amount of preparation work in the background. And the fact that we've had such a good seminar is down to her work. So thank you very much for that. And with that, We are exactly on time, and I'll draw things to a close. So thanks, everyone, and I hope to see you again in the future. Bye.
Bye, everyone.
Bye.
Thank you very
Bye-bye.
much.
Bye-bye.
Bye. Thank
Okay.
you.
Thank you.
Bye-bye.